Hi, I'm Hannah Harmon, and this is my poster, Menstrual Pain Neglected by American University Excused Absence Policies. I know that many people are probably somewhat put off by the nature of the subject and might be tempted to immediately tune out, but it is a reality to literally half the population on the earth and a necessary biological process. This senseless stigma surrounding menstruation, periods, that time of the month, it is even present in American universities' excused absence policies. Currently, to be eligible as an excused absence, the situation must be beyond a student's control and it requires a doctor's note. Universities do not acknowledge the relevance of the amount of their student body affected by menstrual-related issues. It was found that 1 in 5 women miss class due to these issues, but yet are not accepted under the policy. To show how common these conditions are, here is a graphic to illustrate. Endometriosis is a disease where the uterine lining grows outside the uterus and causes severe pain, which can occur at any time, whether a woman is on her period or not. There is no sure cure, and many women opt for surgeries to remove the excess tissue, but it's rarely successful. Endometriosis affects 11% of the female population. A far more common condition is dysmenorrhea, which describes painful periods and exaggerated symptoms. Roughly 41% of the population has this condition. This results in 1 in 2 women having a painful menstrual disease or condition, which is definitely out of their control. The second criteria for an excused absence is that it requires a doctor's note. Unfortunately, even being correctly diagnosed with one of the problems that I mentioned before is very unlikely. In the US, endometriosis takes 11 years to diagnose on average, so unless a woman started her diagnostic journey around age 10, she'll not be getting a doctor's note. Women who go to the doctor to receive medical help for their menstrual conditions are actually more likely to be diagnosed with a mental disease because doctors, sadly, rarely acknowledge female pain. One large study found that women receive more antidepressants, more health referrals for their mental health, and less effective pain relief than men. So where does this bias come from? A history of all sorts of myths and beliefs from a mix of cultures around the world. I included a visual of some of the menstrual myths still present in the world today. There is clearly still a lot of misunderstanding surrounding the subject, many of which have been resulted in today's taboo. The fact is that this is a natural, life-producing process that should be recognized and respected because without it, the human population wouldn't even exist. Women who suffer from these conditions, who cannot focus on a lecture, or some who can't even walk due to extreme pains should not be held to consequences for choosing to be comfortable at home. My solution is to allow women a set amount of excused absences per semester for them to use when they need to. If you want to check out more information, scan the QR code below. If you have any questions or thoughts, leave a comment. And thank you for listening to my presentation.